Now, South Africa's fight against HIV has received a boost from the US Agency for International Development. The South African Medical Research Council has been awarded over 800 million rand to implement a program called HIV Vaccine Innovation, Science and Technology Acceleration in Africa by the USAID. For more on this, we're joined now by Professor Gailbekker, who is the CEO and Director at the Desmond Tutu HIV Center. A very good afternoon to you, Professor Gailbekker. Thank you for your time. 867 million rand is a substantial amount of money. It was a grant that you applied for. Perhaps talk to us about why you felt it so important to get these funds.
Thanks, Simpo. Well, I think 40 years into the epidemic, it has become really very clear that finding an HIV vaccine for prevention is turning out to be a formidable challenge. And to date, most of the R&D has occurred in the Northern Hemisphere, predominantly actually in America. I think this effort is to say, we bear the brunt of the epidemic here in Africa. We do have science and scientists that, I think have also contributed to that fight and to the quest for a vaccine. And it just feels fitting to bring some of the R&D right here to South Africa, to Africa. We will be collaborating with a number of countries in East, Central and West Africa to harness the science that is available on the continent and see if we can contribute to this, this real, what's turning out to be a marathon to find a vaccine.
What's the focus of this research, and how does that then assist with the existing capacity in terms of utilizing what's existing already?
Yeah, so, I think technology has really advanced, and I'm sure, listeners will be aware that recently the mRNA technology took a boost, if you like, because of COVID, and that technology is now firmly rooted here with us on the continent, particularly in South Africa. So we'll be utilizing those kinds of technological advances. But importantly, we'll be looking to find vaccines that meld with the kind of HIV virus strain that is circulating here in Africa. So I think, first of all, it means we really do look for a vaccine that's tailored to our needs. Secondly, we have communities that, have engaged around prevention research for decades, and involving them more close hand right from the very get-go, I think is very important. So this grant will enable us to partner very closely with communities and with other stakeholders. And then, of course, we will be looking to harness young scientists on the continent to make sure that this becomes a sustainable effort. So it isn't just about finding a vaccine, but it's really about finding how to make technology work for a number of different kinds of diseases that are more prevalent here on this continent than other parts of the world and that have been neglected to date.
It's estimated that 1.3 million people became newly infected in 2022. That's in sub-Saharan Africa alone. What are the biggest concerns when you look at the demographics, when you look at the different age groups, when it comes to this continuous spread of HIV?
Yeah, I think the most sort of dismaying aspect of this is we have not been able to really make a dent in the incidence rates that we see amongst young people in this part of the world. So these are young women and girls, young men who have sex with men, young people who use and inject drugs. So it is the populations of, if you like, people who are moving into adulthood and getting on with their lives, but are particularly vulnerable to HIV acquisition. And we just have not had the right prevention tools to turn that around. We've made some progress recently with antiretroviral-based prevention, such as pre-exposure prophylaxis. But we know from history that if we really want to control an infectious disease, it is a safe, effective prophylactic vaccine that is going to make the huge difference. And so the quest must go on to find a vaccine if indeed we really want to control HIV in our lifetime.
And how will that vaccine work? I mean, you break down just one element of the component of the vaccine. What are you hoping to achieve with that vaccine?
I mean, a vaccine, the exciting thing about a vaccine is it really partners and harnesses the immune system, right? Mm. So you hopefully will only have to apply it once or maybe a booster at some point, and then really the immune system is trained and organized to do the rest of the work. And that means, you know, people can have their shot and then get on with their lives. That would be the ideal vaccine. It may be in the beginning we have to give more than one boost, and that, you know, as we're seeing, say, with COVID or with flu, we hope that isn't the situation. You know, we really are hoping for a prophylactic vaccine, which means we can scale it up, get it out to large tracts of the population, and then really bring the infection under control. That's the hope.
Yeah. And in the meantime, I mean, it doesn't look like things are getting any better, especially as you speak about the age group of 15 to 24, which really has shown a frightening pace. What are the timeframes that you're working around?
Well, this is a 5-year grant, and we really do hope that, you know, within a couple of years we'll start to have clinical trials on the ground. We hope certainly within 5 years we will have an African-designed, African-delivered vaccine going into trial. Now, that doesn't mean it'll be ready to, you know, anywhere near to being able to go to scale. But we'll actually be able to test it in human beings. And that, you know, would be terrific. I think my hope, and this is where, of course, one dreams ambitiously, that we'll actually be able to find a product that we can in turn export to other parts of the world. I think that would be terrific.
Costing is always a factor that will need to be considered. I mean, you've received this grant that you applied for, a significant amount of money. Would that in turn mean that when it comes to the continent and considerations on costs, that the pricing would be lower?
Yeah, I mean, I think obviously there are costs to manufacturing, etc., that have to be thought about. But certainly the R&D aspect of this it's being done entirely within academia. We are, you know, all of us behind this, not for the money, but to make a difference and to move the science forward. So that, you know, as a first step is important. Beyond that, hopefully getting it into, if we are successful, if we do have a vaccine candidate, it then needs to be manufactured and you know, taken to scale. That does have a cost involved, but of course we always have our eye on the fact that a vaccine for HIV, for TB, these kinds of conditions has to come in at an affordable rate. It's a good, it's a, you know, a commodity that is for global good, and as such it needs to be available to all. And so that's the other very important reason for doing the work right here in Africa, is we understand that and we want access for all.
It's a 5-year plan, and you say you want access for all, but of course for all is being used loosely here. What sort of prerequisite will be looked at for consideration as you roll it out after you're happy with the amount of work you've done on it? Who will you be targeting?
Yeah, so I think, you know, prevention, any HIV prevention has to be firstly directed towards those who are most vulnerable for HIV acquisition. And so we are looking at, you know, and this is really down the line, should we have a safe and efficacious vaccine once it's been shown to be safe and useful and it is licensed for use, then it would go into the public domain. Probably the age group that would make the most sense for an HIV vaccine, because we're targeting a sexually transmitted infection, are those young adolescents prior to sexual debut. That would probably make the biggest sense. But we also want to be sure that, you know, we are reaching young adults who are most vulnerable to HIV. So it's probably more likely to be the kind of approach as we are, for example, having with the human papillomavirus vaccine at the moment, and that's being rolled out, as you know, at school amongst young women. That's the kind of approach I could imagine we would want to do with the vaccine. There is also an application where one could give it to, children who are at risk of acquiring HIV due to breastfeeding. So I think there are many applications of a vaccine, but first and foremost, we would want to protect young adults as they become sexually active.
Yeah, very exciting developments in this space. Professor Linda Gailbekker, thank you so much for your time, the CEO and Director at the Desmond Tutu HIV Center.